injections. Now, this is what I call the Holy Trinity. We'll go back to that one slide. You can see you have stem cells, you have scaffolds, and you have growth factors. Think of it as a gardening term. Stem cells are the seeds, scaffolds are the soil, and the growth factors are basically the fertilizer. So we basically are in a revolution now in the biologics. We know now, for instance, that we're going to do things that we used to do only in the operating room. We're now doing them in the office as injections. I've been doing that for years now. Now, I have a question. Has anybody out there gotten a patient better? You have? You sure? Hate to tell you, you're wrong. Why? Because none of us have gotten a patient better. Why? Because the cells get the patient better, not the doctors. We guide the cells. We tell them what to do. We give medications. We give treatments. But ultimately, it's the cells. Without the cells, we can't do anything. We're no better than any witch doctor or anything. So it's our cells that get us better. Now, let's talk a little bit about platelet-rich plasma, okay? One thing hopefully that's going to come out today is you guys are all going to learn more, but because you're going to learn more, there's going to be a lot more that you don't know. So the more you know, the more you don't know. That's kind of a little saying I like that I have. So if we look at peripheral blood, we can see that on peripheral blood...
To enter this arena responsibly, with competence and with skill. But even if we use all of our tools in anti-aging that we just shared with you, and even if you're quite skilled in this complex form of medicine, you will see that with our current understanding of science, that the lifespan is limited by these stem cells' ability to regenerate and repair tissue. And we saw this with Enrique von Aldenschipper, the world's oldest patient, who at 115 years old, she still died, okay? So, and she died because it was found that she didn't have adequate stem cells to replace, repair, and regenerate her tissue, even though she had no identifiable disease process, and she was considered to be a healthy 115-year-old. So what this means is that the prevention of stem cell exhaustion and by employing cell banking, stem cell therapies, whether they are autologous or allogeneic, will actually give us additional tools to help.
Lecture objectives, we're going to talk about the role of inflammation, because you hear all these different diagnoses like adhesive capsulitis, sciatic neuritis, disc herniation, gastritis, multiple sclerosis. And so we tend to just think of those categorically, and then from a reductionist standpoint, like what medication or what treatment can we apply to that? But we need to start thinking more broad-based, and particularly the role of inflammation, how inflammation and inflammatory markers are associated with chronic musculoskeletal pain. So these are some of the things you're going to need to work with your patients with. And then also review the regenerative options, such as prolotherapy, PRP, manipulation, acupuncture, etc. And then specific nutraceuticals to downregulate the inflammation and also activate stem cells. So you can use nutrition to activate your bone marrow and get increased activity of stem cells. And of course the lifestyle issues and supplemental therapies specifically for joint and regenerative therapies. So we have to think about what are the root causes of chronic joint pain, right? I mean, otherwise a patient comes into your office and they say, I had a whiplash accident, my knee really hurts when I stand, when I walk, when I move, my knee constantly hurts me, and then you start thinking, well, they're inflamed, I guess. I'll give them a shot of cortisone, give them anti-inflammatory drugs, and send them to physical therapy. That, for the most part, with the exception of some acute treatment, is a dead end. It has very poor science related to it, leads to multiple complications, poor outcomes, and so we need the field of regeneration. And that regeneration means that we're talking about the role of chronic inflammation. So joint pain, any part of that can be cartilage, bone, ligament, tendons, or muscles. You can have tears in your muscles, right, generating the pain. You can have spinal misalignment so you don't have optimum nerve supply. You can have joints that are overly mobile, hypermobile. Like, you go to the chiropractor or you go to the physical therapist and you go like, wow, that really helped for a day or 2 days with my back pain or headaches, but now it's back again. Well, is that a change of technique, strengthening your body, or regenerating it with a regenerative substance? Most commonly, joint pain refers to arthritis and arthralgia.
But it's really a great pleasure to speak to you on microcurrent. It's been a big part of my practice and life, probably for 15 years. And whatever you do in your practice, microcurrent can be beneficial in helping you. If it's anti-aging, if it's hormones, prolotherapy, you name it, microcurrent should be part of your practice. Disclosure, I'm on the board of directors of iCell, medical consultant for Inspir, and I have no financial support for this presentation. If anybody wants to make a contribution, I will take your money. I believe in synchronicity. New York Times Magazine, on my birthday, May 25th, 2014, dedicated the entire issue on microcurrent and the body electric. At last, Big Pharma is beginning to recognize that microcurrent may have some application in health. If you would like a copy of my book, Microcurrent Miracle Eye Cure, just go to microcurrentbook.com. Easy to remember, and you can download a copy of the book. The book's a little outdated, but the historical aspects are still current even today. I'm in the process of rewriting the book. This book was published in the year 2000, 16 years ago. I like what Dr. Roger Billica said. If my office caught fire, the first thing I would save is my microcurrent machine. And he's an integrative doctor, does a lot of cardiology. Believe it or not, microcurrent is FDA approved to treat cardiac problems. How many here were aware of that? There's actually a commercial device out there.
So today we're going to talk about what I call the CFAN model. It's a model that we use for optimal healing to get the regenerative procedures that we're doing to get the best outcomes that you can get. So it's exciting, and it's definitely a big passion of mine. So our goals when we're trying to regenerate something is a few things. We want to make sure that we get regeneration happening at the site of the local injection. You want to make sure you make an optimal environment for healing. So we want to make sure that once you inject it there, that you do things that promote the healing process and keep that healing process going. You want to make sure that we maintain that. We also, as we're doing this, we want to reverse all of their chronic diseases as well. So that's why we talk about things like weight loss, things like nutrition, changing their habits so you have better outcomes in that chronic disease. If we look at what's happening right now with regards to our health and our societies, unfortunately, things are going the wrong way. Now, we're all here because we are passionate about making people healthier, but if you look at stats, by 2020, 40% of that adult population is going to be overweight or obese. What's sad about that statistic is that the little penguins that are following their parents, they look just like their parents. They are obese, they have the same eating patterns, and they aren't exercising the way they should. So it's creating a problem there when it looks like, with our chronic disease stats. And if you look at extra body weight and disease, the top ones are related to what we deal with is orthopedics, is pain, is worse joints, worse tendon problems, a lot of low back pain. Not to mention the metabolic and the cardiovascular problems that happen as we carry extra body weight. It is really creating a crisis. It's not just that we have a lot of patients in pain, a lot of patients that are breaking down, but that equals more health costs, more prescription medications, more surgeries being done. So things are going to implode. We just had an election, and one of the top topics is always healthcare because it is so dang expensive. Our premiums are so high. We need to start focusing.
Okay, everybody, I guess we need to get started. I'm Dr. Parita. I've kind of been bouncing forth between here and the Stem Cell Fellowship. I was lecturing there. I'm going to talk today about stem cells and PRP, and I'm going to give you some of the science. I'm an orthopedic surgeon. I've been doing orthopedics for about 35 years and stem cells for 10 or 12 years. So I've been doing quite a bit of this stuff. So basically here we can see what I call the holy trinity here. We have stem cells, we have growth factors, we have scaffolds, and all these together are how things work. And this is pretty much how everything works. Here in regenerative medicine, this is it. But let's move on. This is our learning objectives. We can skip that. Here's a great slide. Okay? Everything we do in regenerative medicine, it's basically the cells that are getting the patients better. We don't get the patients better. We can kind of direct the patients. We can direct the cells, but ultimately it's the cells. You do a hip replacement, that's the cells have to heal that wound. You do a heart replacement, that's what has to happen. Things like that. So let's move on. Okay, so what's involved in tissue regeneration? Well, we've got a PRP, we have bone marrow, we have fat, we have cells, we have singles, we have scaffolds, and guess what? We have angiogenesis and vasculogenesis. And I want to talk to you guys about that in a little bit. There's a big significant difference between the two of those, okay? And you have scaffolds, okay? Now, what's regenerative medicine? Well, there's a couple of different definitions. Now, we know that there's physiologic regeneration, okay? We know that there's also regeneration where you have like certain amoebas and things like that. Then we have reparative generation, okay? And we can see damaged tissue will repair itself. We can see that we have other tissues that repair themselves. We have hypertrophy. These are all part of regenerative medicine, okay? But you can see there. So that's the whole field of regenerative medicine. But we're going to concentrate today more on the stem cells and PRP part of it. Now, I need to give you guys some science. Look, I'm a clinician. I hate the science, but we need to know it some. So we know that any cell has the capacity.
Dr. Gonzalez at W2 Biosciences is responsible for the development of clinical stem cell applications for several disease and trauma states. He also leads 2 affiliate companies which market cells and cell-based products. Dr. Gonzalez has several scientific publications in the stem cell field. He obtained his PhD and bachelor's degree from University of California, Irvine. Today, he will be talking about allogeneic stem cells for autoimmune disease. Welcome.
Thank you very much for the introduction. How's everybody doing today? Awesome. Great. Okay, so today we're going to discuss, everybody's of course heard stem cells a lot, and it's gaining more and more traction every single day. It's a great topic, but does it really work? A lot of people incorporate it into their practices, and a lot more and more data is coming out on a daily basis on stem cells. The learning objective we're going to discuss here is that we're going to define autoimmune disease and some treatment options. We're going to identify adult stem cells and their sources, and then discuss allogeneic stem cells and their clinical success in various autoimmune diseases. Particularly, we're going to discuss allogeneic cells and also autologous cells a little bit, and why allogeneic cells is a better choice. By the end of this lecture, I want you to understand the data that's out there that describes why you would want to use an allogeneic source versus your own stem cells. So just a little bit brief history. As everybody knows, you're all in the medical profession here. Autoimmune disease, as everybody knows, an abnormal immune response to any normal body part. No cure, of course. What's the biggest problem with autoimmune diseases? And there's more and more occurring. There's over 100 of them that we know of already. But there's more and more of them, newer ones actually, that are coming up on a regular basis. What we know about them, the weird, unusual thing about it is that it's 2 different systems that are attacking your body. So how do we deal with it? We have to deal with an immune response, and then we have to deal with the target tissue, like for instance in the case of multiple sclerosis right here, we have destruction of central nervous system tissue that we have to repair also. So this is what makes autoimmune diseases relatively difficult to deal with. 7% of the U.S. population, 24 million people, that's a staggering number, have some form of an autoimmune disease. They either come genetic.
My name is Joe Parita, and I'm the moderator, so I guess I got to kind of introduce myself also. So got to kind of wear 2 hats here. So anyway, I'm Joe Parita. I'm an orthopedic surgeon. I've been orthopedic surgeon for about 35 years. And I've been doing stem cells for maybe 10, 12 years. Okay, so this is going to be about stem cells. I myself am going to do a lot of the science. One thing I'm going to preface it with, this is one field of medicine where each and every one of you can make a difference. You know, you can practice cardiology, orthopedics. You're not going to make a difference. You may actually make a difference here. So, all right, so we're going to get started. There's a lot of science here. I believe you guys have the copy of my slides, so you can do that. We'll breeze through some of this. We're going to talk about the Holy Trinity. I want you guys to think of this as maybe planting a garden. And like any garden, you've got fertilizer, growth factors. You've got scaffold, well, the soil. And you've got stem cells, the seeds. All right, so this is the learning objectives. Now, I have not gotten anybody better in all my years of practicing. And here's why. Because it's the cells, not the doctors, that heal the patients, okay? You know, you can do all you want. You can help the cells, but ultimately the cells. You get an open heart surgery, it's still going to be the cells that are going to get you better. You get a total hip, still your cells are going to get you better. All right, so what's involved in tissue regeneration? Well, we've got cells, we've got singles, and we've got scaffolds. All right, so basically we have the physical environment that we have to worry about, and we have angiogenesis and vascular genesis. We'll talk about that in a little bit. So, what is really regenerative medicine? Well, we've got physiologic, we've got morpholaxis, we've got reparative, we've got other portions of the reparative, and we have hypertrophy. So this is all parts of regenerative medicine. Now I want to get into some of the, we've got to talk about some of the technical stuff here. I want you guys to have a knowledge, so when you really do it, I don't want you just to take a weekend course and say that you're a stem cell person. So here's what we're dealing with here. The principle, one thing we need to talk about is plasticity. This means that one cell can actually form a different kind of cell. But one thing you need to be very cautious, especially in this field, be very cautious about in vitro studies. Because when you start studying a stem cell outside of its niche, outside of its environment, it may be doing totally different things. So that's why we say we have cellular uncertainty. And then we have something called stochasticity, okay? Again, a fancy word, but something we should kind of at least be.
All right, we'll keep this rolling here. We're going to be talking about regenerative orthopedics, stem cells, PRP, prolotherapy, things like that. I know Dr. Parita covered a lot of stuff. It was some very good, useful information. I'm going to go in a little less technical sense, maybe the more practical sense. As he said, both a medical physician and a chiropractor. I was a chiropractor first, but it's a long story. And these are just some references they have us put in here. Oh, wait a second. I went the wrong way. Thank you. There we go. The name of my practice is actually OrthoRegen. I just reclassified that. It used to be that big, long name, Pacific Prolotherapy and Medical Wellness Center. But if you Google either one of them, you'll find me. I'm in Santa Monica, California. And yes, we have beautiful beaches, just like you do here in Florida. Some of my objectives here is to learn about identify joint function and control, and also list some of the benefits of non-surgical regenerative joint repair. I hold both, I told you, licenses, certifications, and I also teach at the University of Wisconsin, one of the largest courses on this, and you can ask me about that later. And also at the local chiropractic school, I help to preceptor some of the new doctors there. So we're going to take it way down because many of us have been out of school for a while or don't do musculoskeletal. How many people here do musculoskeletal medicine? Oh, great, great. Well, that's really good. So hopefully it's not too basic, but what controls joints, ligaments, and tendons? And I think it's the star, right? Yeah, there we go. So on this side you have skeletal muscle, which attaches to tendons, and on this side you have ligaments. There are no muscles. So this side here is stability, and this side here is mobility. And as this says, you'll see here, if you get weakened, torn, damaged ligaments and tendons, there's going to be increased pressure and pain. Then when you...
Okay, good afternoon. Thanks for coming. My name is Dr. Dar. I'm an orthopedic surgeon in private practice in Covington, Louisiana, which is about 40 minutes outside of New Orleans. So I've been in private practice for 23 years, doing traditional orthopedic surgery, a lot of total hips, total knees, total shoulders, knee arthroscopy, and then some trauma fracture work. Been very successful with these patients. However, over time, I felt there was a missing link in the care of the orthopedic patient. You know, traditional orthopedic treatment, physical therapy, anti-inflammatory medications, steroid injections, bracing, and then they didn't get better, and then surgical intervention. Nothing wrong with that, but I felt that we could offer more options to the patient. About 6 years ago, I started instituting stem cell treatment in my practice. Started off with plate-rich plasma, then evolved to bone marrow stem cells, and then also fat graft. So I'm pleased to be here today to share with you some of my results on my interim analysis of the combined cell therapy for the treatment of pain and function associated with osteoarthritis. My talk's about 20 minutes, and then we can open up for questions, make it a real interactive discussion here. The purpose of today's presentation is to define the components of combined cell therapy and explain how they work, and discuss my current application of these components and the evaluation of the patient responses to this treatment with regard to the symptoms of osteoarthritis. I have no potential conflicts with this presentation. Osteoarthritis is characterized by inflammation of the joint, which can cause pain, swelling, and stiffness, amongst other symptoms. It is most common in those over age 50 and is most frequently caused from degeneration over time due to wear and tear of the joint. When comparing a normal knee with a knee with osteoarthritis, there is typically a lot of inflammation. Bone spurs may be present, articular cartilage can break down, exposing the bone. The current treatment of osteoarthritis includes lifestyle modifications such as minimizing activities that aggravates the symptoms, switching to low-impact activities.
So I'm going to introduce our next speaker. I've never met him before, but he seems like a very nice fellow here, and he's going to talk to us about autism and stem cells. So with that, I'll let you talk. My pleasure.
All right, perfect. Well, good afternoon, and good news is that this is the last talk of the day. And for those of you actually considering treatment, we don't normally have to worry about our patients taking statins or abusing alcohol. That's rarely the case with our kids with autism. I was very fortunate to participate in the Stem Cell Fellowship earlier in December with a talk on what we've been doing over the last couple of years with our stem cell therapy in treating autism. I think as we're going to explore today, it is becoming a lot more relevant, and for those of you who want to start getting involved in the stem cell field, you're going to start seeing a lot of people start requesting it. Especially now, just this week, Duke released the results of their first safety study with stem cells for autism. So I'm going to go a little bit over how to recognize autism, how to identify the kind of patients that could benefit from your therapy, and exactly what we are doing at our clinic that has been giving us results for the last couple of years. I always like to start with this quote, and I really don't know who said it originally, but it's very common in the autism community. And it says, behind the child that makes the most progress is an actively involved parent. And it really goes to show, with everything else that we've been hearing about today, stem cells, while they have a huge healing power, they don't work on their own. We still need to do a lot of other things to make sure that they're reaching, per se, their maximum potential. And what we've seen in the autism community is that the parents who actually are involved both before, during, and after treatment are the ones whose kids get the better results. We feel after 5 or 6 years of doing this, of talking to other physicians, talking to other specialists in the autism field, we believe that this has helped us understand and develop a better treatment, figuring this out. And I'm going to share